Hello everyone. So today I want to talk about pelvic floor health, and obviously this is important for both women and men to understand and be aware of with your pelvic floor. So the pelvic floor is a combination of muscles that sit like a sling, so think of it like a hammock, at the base of your abdominal cavity in between the pelvic girdle, and it supports all your internal organs. If you're a woman and choose to have a baby, it supports the weight of your baby, and basically it keeps everything where it needs to be. And what happens as we age, or if you do have babies, if you lift heavy weights, a lot of extra additional weight bears down on that pelvic floor, and if you're not strengthening it, or if you don't know how to activate it, especially doing heavy weights and as you have babies and things, it can actually loosen and lose its strength, which obviously poses massive health risks and also leads to things like prolapse, which we'll talk about another time because it's not spoken about enough, and I want to raise the awareness around that. And again, so side note, prolapse is a risk that both men and women face, so it's important for men to understand the health of their pelvic floor as well. So you'll notice in the examples that I shared, they were female pelvic floors, and there's a few additional openings, and that's because as women, obviously, we do have a few extra openings. So what actually goes through the pelvic floor is your urethra, which allows urine to come out, your rectum, obvious there, and for women also your vaginal opening, which is why after pregnancy it's important, so important, that you do see your women's health physio and get your pelvic floor checked out, because as the baby comes through, if you have a natural birth, it does obviously stretch and expand the pelvic floor, and there's so much extra pressure that's compacted on it. And then even without that, again, talking about the weightlifting, if you hold your breath when you do reps, which most weightlifters, that's the breathing technique, you have all that additional air in the abdominal cavity as well as the extra weight that's putting pressure on the pelvic floor. So it's really important to take care of it. It also is important. So some simple pelvic floor exercises is sitting on the corner of a chair. Imagine you're on a cold bench, you're going to go into cold ice water, and you want to close all the holes, so the rectal hole, the vaginal wall, so you want to imagine them coming together, and then gently lift. So if you're a woman, if you use tampons, imagine trying to lift that slightly, or trying to pull away from the bench without anything else moving. So that is some simple ones you can do. There's more, but that's probably the best way to start and ask for a professional's advice. Some benefits of good pelvic floor health is obviously reduced risk of prolapse. If you strengthen that, you get a better activation of the abdominals, which obviously has better core strength, less back pain, etc., etc. And if you're a woman, good pelvic floor health leads to amazing, better orgasms. Yay! And that's something we all enjoy. So that's some really important things. As online consultations, I do ask about pelvic floor health if you have any pain or unsure. And if you aren't sure or want some, to get it. Also, I do want to add though, there is a lot more additional information about the pelvic floor that it's kind of too in-depth to just chuck in one video. But keep in mind, no one's pelvic floor is perfect. So some of you, you might have a tight pelvic floor or slightly lifted pelvic floor, and instead of exercises, you may actually need stretches for your pelvic floor. So I genuinely recommend for everyone to see a pelvic floor physio or a women's physio, just for your own knowledge. You can get real-time ultrasound, so you can actually see your muscles in real time via the ultrasound. You can ask questions, you can get to know your body, and it's just important and incredible. So again, if you want any advice or any help on where to go, who to see, I'm more than happy to help you out, which is what I was trying to say before it cut me off and then it just was awkward, so I will finish it off on that. So I might do a few more little segments, but I definitely want to speak about